Good afternoon, everyone. This is Dr. Bhupesh once again for you all, assuring you for the best OET coaching. Our contact number is 76967342256. If you are out from India, then you +91. And talking about the reading part A today, I'm just going to go through. We were doing these questions. We have already done these questions and discussed, but I'm recording this session just for you guys and wanted to tell you the importance of reading part A. Reading part A carries 20 marks. Reading part B and C carries 22 marks. So there is hardly any difference between the marks. That means reading part A is equal to reading part B and C. And reading part A is easy to be done. If we do not do silly mistakes out of the pressure, then we have high chances that we will clear reading for sure. Even if your reading part B and C is little weak, even then it's fine if your reading part A is very good. So please understand. So we did few questions. I would like to do those questions for you. But before I do that, I will also tell you the method, because we have not talked about the method. But in this recording, I would like to tell you about the method of how to do reading part A. First of all, thanks to creator of this question paper, that is Cambridge Box Hill Language Assessment, and that is original OET site. Thank you for creating this question paper. Again, my job being Dr. BKM Institutes is to tell you how to do it. So in the exam, what will happen? You will get exactly this kind of a question paper. As soon as you get the question paper, you read all these 7 questions. The point at which any necessary pain relief should be given. Point, pain relief, 2 keywords. Underline them. Benefits and drawbacks of specific classes of drugs. Means classes of drugs. Drugs means classification. That drugs would be classified A, B, C, various kinds of drugs. Financial considerations while making a decision about sedation. Means general question. First question was pain relief. Second question was drugs. Third question was financial consideration. Typical procedures carried out under various sedation levels. Various sedation levels mean mild, moderate, something like that. Measures to be taken to ensure a patient's stability under sedation. Means what kind of measures to be taken. Reference to research. Research word is a very important word, and alternative word we might find. Patient's level of sensory awareness, that how much senses are working. So you don't have to do, you have read the 7 questions, then you go to paragraph and then you read. Procedure, sedation and analgesia for adults in the emergency department. Patients in the emergency department, combinations of benzodiazepine and opioids. This can be the classification of drugs. Local factors including availability. Then you talk about level of sedation. So one question about was level of sedation. So the answer becomes B of that question, where they were talking about the level of sedation. At least one question you can find for sure. Minimal, moderate, deep. So this was the answer I was trying to find. Dissociative sedation. Then there were drug administration. Drug administration means when the procedure is done. So there was one question regarding the procedure where they were asking about the measures. So this can be one of the answers, or measures can be from this. So either A or C when it comes to measure. Then I reached to this question. It talks about the various classification of drugs, opioids, benzodiazepines. So answer which I was thinking to be A becomes D. Now if I do the point at which necessary pain relief should be given, so it should be over here, the point at which necessary pain relief. If pain relief word is given over here, then I will do this. Otherwise, pain relief word, if is given, is this painful, analgesics. So I think the answer should be A, but I'm not sure about it. In the final exam, I will not attempt it in the first round because I'm not getting the word pain relief, but pain word is discussed over here. So I would, at least if I do not find time later on in the last, then I will write A. So first I will like to do A, but in the first round, I will not do it. Means what I'm telling you, how to save time is not to get deeper into the layers when it comes to reading part A. So when people try to do first question, they get trapped with the time. So if you're not finding it easy, let it go. So pain relief word is given. We will put the guesswork later on if we do not find time. Benefits and drawbacks of specific classes of drugs. Let's see, advantage and cautious. So that means benefits and drawbacks. 100% D. Financial considerations. Financial means talking about the cost. Anything that talks about cost, familiarity, cost factors. A. Again becomes 100 short answer A. Typical procedures carried out under various sedation levels. Procedures carried out under various sedation levels. This, and is it talking about some procedures? Verbal commands, sleepy, aroused. It's not talking about procedures anyhow. Procedures. Again, this becomes a difficult question, but this is like various. This is procedure. Any procedure? Capnography, competent personal, advanced airway management, life support. I think answer should be C, because sedation levels are either discussed in this or in this. But over here, I was not finding any procedures. Over here, I am finding some procedures like capnography. Then I am finding emergency department. So I would like to do this answer as C, but again, not sure. Sure. Measures to be taken to ensure a patient's stability under sedation. Measures to be taken. Measures to be taken. Patients require this. Again, seems like a difficult question. Can't help it. A difficult reading part A. Matlab, normally it is not that difficult. So at least I'm sure about second, third, fourth, not sure about this question. So first and fifth I have left. Reference of research into alternative sedative agents. Reference of research. Anything that talks about study, data, research. Research word. It should be clear. Research. No. Research word. American Society of Anesthetics. Not given. Again, not. But the only thing you need to do is not to waste your time. Again, I'm not finding the research word. I would let it go. Yeah, research word is gone. Let it go. Patient's level of sensory awareness. Level of sensory awareness when they are sedated. Level of sensory awareness. Mild pain control. Patients are sleepy. This should be my answer as B. So I've done 5 questions, and in the final exam also you would be maximum would be able to do 5 or 6 questions. Now, before I go forward, I just need your help to understand how many questions I have done right. In the exam, I will recheck it, but I'm just telling you how to do fast. So just wanted to confirm how many questions I have done right or wrong out of the 5 questions I have attempted. Second, D 100%. Third, guys, third.
Yes, sir.
A.
Correct, sir.
That means we got it right. Our guesswork or fluke was right. Then typical procedures carried out. I'm not sure about this, but various sedation levels. C. Not sure. I'm not sure about it.
No, sir, it's B.
Fourth B. Could have been B and C again. I was not sure about it. Measures to be taken to ensure this I did not do. Reference to research. Measures to be taken to ensure patient stability I did not do. Patient's level of sensory awareness 100% C. Oh, sorry, B. Patient's level of sensory awareness. Is it B?
Yes, sir.
Yeah. So I've got at least 4 questions right out of 5, which I did. And now again, but still now I would like to save my time. Later on, I will find the research or something like that. Now, please understand, when you reach to 8th question, don't forget this strategy. What class of drug is traditionally administered? So it should be in which thing? What class of drug should be in which thing? Which part?
D.
B part. Now you will save your time. What level of sedation is appropriate for changing burn dressings? So burn dressing either in B or C, burn dressings, minimal sedation. Now you understand it's either in B or C. So you save your time with this method. That is how you save your time. What is the only emergency department procedure? Procedure was given in which paragraph?
B.
Paragraph procedures were given in C, na?
Sir, C.
C. Procedures were given, na? But it can be chalo anyhow. It can be B or C, but I think procedures were given over here. Done. That is how you save time again. And again, what class of drug? Again D. What opioid drug? Again D. What is the minimum over? Again D. With the majority of the sedative drug are administered via, it can be in the A part, because in the A part there can be that they must be doing through IV or something. A, B or C. Maximum procedures are done through IV must be given over here in the A. Interview is
Yes, sir, A.
the generally means is the major thing. So IV route becomes anyhow we know about sedation, guys. But I'm not saying do it by yourself. Then general anesthesia is one of the sedation under which patients may have reduced, I don't know in which part it can be, patients under minimal sedation. Minimal sedation was given in the word minimal, moderate,
B, sir.
D part.
B,
Then
sir.
B. Care should be taken while administered etometide. Where were the drugs given? Where were the drugs given? D.
Part D.
D, sir.
That is how you save time, guys. Now you understand the strategy. It may be helpful to capnography was given in which part?
C, sir.
Fentanyl, morphine, and midazolam, which would be in which part?
D,
D,
sir.
sir.
Now you save your time, guys. Now you save your time. This is how you do it. Now talking about the various questions which we have discussed. So we discussed, I will discuss all the questions for the guys who are not present today. So we did one of the question was seventh. Seventh, no, we did not do. Sorry, we did not do any of these questions. We did, you asked me question number 10th. What is, now this is a very special question. I'm recording for this question as well. What is the only emergency? Now only word is very important. So while we were doing this question, I noted the keywords emergency department procedure, for which it is appropriate to use general anesthesia. So I went for the keywords only, emergency department, and general anesthesia. So when I went to the reading part, I could find general anesthesia over here. Then my word was only. So I picked up the word except. That was it. If I say he is the only guy, that means everybody is average except this guy. So only word resembles except. So I didn't have to read it even to do emergency intubation. So when I reach to this question again, now I will check it again. So what is the only emergency department procedure? Emergency intubation or intubation. Both are correct. Emergency intubation or intubation, both will be correct. What is the emergency procedure? Intubation or emergency. That is how you fit in the blanks and save your time. Then the second question we did was
13, sir.
sorry,
13.
13. Which opioid drug should be used? Which opioid drug? So we know we are talking about opioid drug using a specific. So I went to this part, then I could see opioid. So that means I have to pick one out of these drugs. So I went to find any equipment. So there was no equipment. Then I reached to this point, red point. Then it's infusion pump. So I know infusion pump is an equipment. So I answered it, remifentanil. Again, I saved my time. You know where it is. You know opioids, only 3 drugs are given. You just have to find an equipment. Infusion pump is the only equipment mentioned in all this thing. So again, you save time. And you become confident as well when you save time in these questions. Then you will have ample time for the difficult questions. Then we did patients under minimal sedation will react. So minimal sedation, I know it was given either in B or in C. So I went over there. I picked up the word minimal sedation. All right. Then I said, okay, now let me see what are the other things given. So first of all, I try to find where it is. Then I read the question again. So first of all, I just pick the keywords. I do not try to understand the information. Now I will try to understand the information that patients under minimal sedation will react. Will react. Will react. Then I went on to this blank. I understood patient respond. Respond means action. When somebody asks us, we respond, we react. So patient respond normally to verbal commands. And then I went over there and tried to fit the word patients under will react if they are given verbal commands. So react means patient will respond to verbal commands. That becomes my answer. Again, I save time because I could resemble these two words, react and respond. So please try to understand these things. Simple strategies. Then we talked about this 19th question. Again, I always notice the words like only, even in the part B and C, even in the listening. It becomes very important to understand these points. It may be helpful. Maybe means probability, possibility, likely, high chances. There are high chances. There is probability. There is possibility. May means possibility. So it may be helpful to use capnography to keep to keep track of patients' dash levels. So we have to talk about something which has the levels. So when I went on to this, I know capnography was given in the C part. So when I went on to this word, I found the word capnography. Then the second keyword was moderate sedation. So then I went on to again. So capnography was given in these two things. Capnography was given in moderate. Capnography was also given in deep. But my question has the keyword of moderate sedation. So I understood one point, that it is not from this, it is only from these three lines. Again, I save my time because I know it is from these three lines. Then there was another word. Then there was this important thing I'm telling you guys. Please notice it very carefully. There is a comma before and. So whenever we do the writing task, I always mention this thing, that when you do the writing task, when there is a comma before and, this comma before and means that the previous sentence has nothing to do with this sentence. Means these two sentences are independent clauses, are independent sentence. So then I could find that in the line in which capnography was given, the only thing that can has level is carbon dioxide, because carbon dioxide is the only thing that can have the levels. Concentration means level. If I tell you in my blood, concentration of sugar is this, that means I am saying in my blood, level of blood sugar is, concentration of blood sugar is this. So that is, again, I saved my time with my basic rule application, which was that there was a comma. That means this line cannot have my answer. So I have to find the answer. Then I found the word concentration. Concentration mean level, level of carbon dioxide. Again, this was the most difficult blank. But again, if you follow the strategies, understand the commas, independent clauses, this is, and again, you don't have to worry. Don't say, sir, we don't know about this thing. I'm telling you this thing right now. This is the most different rule of English, that when there is a comma and, like, required treatment was given, I will show you. When we do in the writing, required treatment was given, comma, and his condition got improved. That means this sentence, the last sentence, has nothing to do with this. Means they both are independent sentences, means complete sentences. Required treatment was given is a complete sentence, subject, helping verb, verb. This is a complete sentence, subject, verb in the second form. That's it. So his condition got improved is a complete sentence. Required treatment was given is a complete, two independent sentences. So that is why we put the comma. So please understand this thing. This was the most difficult question we did today, but again, we did it just with utmost ease. And now the last question that we discussed was the 20th question. Fentanyl, this was also interesting question. Fentanyl, morphine, and midazolam each have a. So I know this is the drug classification. So I went to these words, F, M, and M. So I just went on to this blank. F, M, and M have a. So these three drugs have one thing. A means one. So these three drugs should have a common thing. So when I read the three things, I could find the word reversal agent, reversal agent, reversal agent. So can have a reversal agent. So these three drugs can have a reversal agent. Then I could have filled the word naloxone, but I did not fill the word naloxone because naloxone, but in this it was fumazanil. If it also would have said naloxone, then naloxone could have been the answer. Reversal agent could have been the answer. Both the answers have been correct. But now when naloxone is different from fumazine, only one answer can be correct. That is reversal agent. So that is how you do reading part A in a very quick and in a very fast way. This is what fetches you the maximum marks. This is Dr. Bhupesh again telling you how simple reading part A is, how fast it is, how fast you can do. And now by chance, if I do not have time in the exam, I have 3 questions in the part 1 to 7. 1 to 7. So I will just say the point at which pain relief should be given. I would like to do this as A maybe. The point at which pain relief, because analgesics was talked about this. I think there was nothing about pain relief in this. Nothing about pain relief in this. So I will put it as a kind of a fluke. First answer is A, generally asking. Or is it like?
Yes, sir.
Yeah. So you get the answer A. So one tukka, one fluke is correct. So I get 1 more marks. Then I talk about financial consideration, typical procedures carried out under various sedation levels. So that was C, right? Uh, Procedures. Or it was B. It was C.
B.
C,
sir.
C, na? C only. That was talking about the procedures like capnography and everything, na? So,
B. Answer is B.
sir.
but again, I could not find it in
Excuse me, the procedures are direct cardioversion and the second one example major joint reduction, like that the procedures
fracture
are.
reduction and everything. Okay.
Yeah, that are the procedures.
Okay. So one question went wrong in my case, and in exam also, I'm not saying I would have found the time. This question would have been wrong. I can afford one or two question to be wrong. So this one is wrong for me for sure. Okay. Dashpal ma'am, can you put it on mute, please? Measures to be taken to ensure a patient's stability under sedation. Measures to be taken, patient stability. Anything that talks about stability? Stability. Nothing. Nothing like stability is given. This is also a difficult one. I couldn't find the word stability. Nothing. So again, I don't have time, so can't really do. Either I will do A, B, or C, but I cannot find anything.
Sir, in the part B only there, sir. Dissociative sedation law.
Yeah, verbal command is the only word where I could guess it, but again, it's a hard one. Something that I might do A, B, or C. I would be honest to you. Reference to research into alternative sedative agents. Research word should be only American Society. This is the only word. Otherwise, I could not find the research again. Alternative sedative agents is the other word.
Part A.
Sir, part A, the trials or
Part A.
observation studies.
Observational studies. So yeah, this is the one. Any word, research means trials, research means studies, research means data. Any word like studies, data, or trial is given, that means it is research. Always remember this word. And then the last one, patient level of sensitive and sedation. This must be the answer, right? Level of sedation, right? So again, first 1 to 7 questions were tricky, but please understand, suppose if you get yourself in a fix that I won't go ahead until I do my first 7 questions. So that means today your exam is gone. So don't stick to anything in the reading part A, which takes time. Again, I told you the importance of first 7 question. If you follow the right strategy, then you understand 8th question is in the B part, 9th question is in the B part, 10th question is in the C part, 11th question is in the A part. So you save your time. And when you reach to reading part B and C, again, you follow the same strategy as A part. That means in the part B also, out of first 6 questions, 4 would be easy, 2 would be difficult. Please do not waste time in the first round. This is the main strategy to pass OET reading. Do not do difficult questions in the first round. In the part B and C, if there are 42 questions, you get around 22 questions, you get around 10 to 12 questions, easy questions, right in the first 20 minutes or 25 minutes. Suppose in the first 25 minutes, if your 12 questions are right, which are easy ones, that means you have already passed. So please understand this fact. Again, I tell you every time I do this thing, reading is not about how good you are. Reading is about how better you manage your time. So when you do only easy questions, you will have all the time of the world. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you.